you have a tight foreskin and then you go to a doctor and they diagnose you with phimosis and they prescribe a steroid cream, usually something like Elicon, Betnovate, betamethasone, mometazone, something like that. How do you actually use it to help loosen that foreskin? The most important thing is that you do not want to be forcibly retracting the foreskin because it can cause pain, damage, bleeding. It could even lead to a different type of medical condition called a paraphimosis, which is where the foreskin gets pulled back and then it's too tight to be pushed forward. And that can lead to a whole host of other problems, and it would be deemed as a medical emergency. But the way that you do it is that you gently try and retract the foreskin and you apply a really thin layer of steroid cream to the tight part of the foreskin only. You don't really want to be putting it onto the gland, so the head of the penis, the helmet. It's just on that outer layer of the foreskin, which is tight. There are a few different schools of thought for how to apply the cream and for how often and for how long. But one way to do it is to do it every night for 2 to 3 months. And then you start gradually weaning yourself off it. So then you do it every other night for, let's say, 2 weeks, and then twice a week for 2 weeks, and then you can stop. So you're treating and then you're weaning yourself off the steroid over a period of kind of 4 to 6 weeks. Let me know if you have any questions in the comments below, but you've got to make sure that you've got the correct diagnosis by going to see a doctor. Any problems, have a chat with your doctor or nurse or GP surgery.